In this next video, we're going to talk about liver function tests, or LFTs. What it consists of, what you're measuring, shorthand notation, normal values, and some tips and tricks for the wards. Your standard order for LFTs will include albumin levels, total protein, direct and indirect bilirubin, AST, ALT, and ALP. Depending on your facility, and if you want additional tests, the laboratory might also run a PT, INR, APTT, GGT, and LDH levels as well. We're only going to focus on these laboratory tests here in this video as they are the standard orders for LFTs, but we'll talk about these other laboratory values in another video. Not surprisingly, the components of the liver function test give you an idea of how well the liver is functioning. Is it functioning good or is it functioning bad? Abnormal values will tell you that the liver is not doing so well for whatever reason. The liver normally produces proteins and albumin found in blood. So decreased total protein or decreased albumin levels are a sign that your liver could be damaged. Malnutrition or nephrotic syndrome are other potential causes of decreased total protein and albumin levels respectively. For bilirubin levels, AST, ALT, and ALP, lower numbers are good. Elevated levels of these markers could indicate liver damage. Let's talk about bilirubin first. The bilirubin report is often subcategorized into direct, aka conjugated bilirubin, and indirect, aka unconjugated bilirubin. This distinction is important because it can help you localize the site of hepatic damage. If it's only the indirect bilirubins that are elevated, this is a sign of prehepatic damage, such as hemolysis. If it's only the direct bilirubin that's elevated, this is a sign of post-hepatic damage, such as biliary obstruction. With direct liver damage, you could see increased levels of direct or indirect bilirubin. AST and ALT are commonly referred to as transaminases, and they are good indicators of direct liver damage. Remember that ALT is more specific for liver damage than AST, and you can remember this because there is an L for ALT. AST can also indicate damage to the heart, skeletal muscles, kidney, and brain, which is why it's less specific than ALT. Alkaline phosphatase, or ALP, indicates biliary membrane damage, such as from biliary obstruction, but can also be found in relation to damage to bone, intestines, kidney, and the placenta. Now, the shorthand notation for liver function tests that I use looks like this, in which AST goes here, ALT goes here, total bilirubin goes here, ALP goes here, total protein goes here, and albumin goes here. But be warned that this is less standardized and can vary by institution. The normal values of these tests are listed here for your reference, but again, please keep in mind that this will vary depending on what source you use, so don't send me angry emails, because I might write angry emails back. Now we get to the fun part, which is tips and tricks for the wards with respect to LFTs. The most common thing you'll hear is that if both AST and ALT are elevated, but that AST is elevated over ALT at a ratio of above 2:1 or around 2:1. This is a sign of alcoholic liver damage. On the flip side, if ALT is elevated more than AST, this is a sign that you can have viral hepatitis or you can have fatty liver. If the ALP is elevated along with bilirubin levels, this could be a sign of biliary obstruction. Another nice thing to know is that jaundice is a clinical sign that you usually see when the bilirubin level is above 2.5. The last trick I have for you is that if you subtract the albumin level from the total protein level, you get what is called the gamma gap. And this value is normally below 4. But if you have a gamma gap greater than 4, this could be a sign that there could be more protein in the blood than there should be, which could be a sign of processes such as AMGUS or multiple myeloma. It's rare that you'll run into this, but it's a neat finding if you ever get to see it. Now, here are our take-home points. Number 1, a standard LFT test will consist of total protein, albumin, bilirubin, AST/ALT, and ALP levels, depending on your lab, and if you want to add extra tests, you might also get PT, INR, APTT, GGT, and LDH levels as well. The shorthand notation that you could use for LFT values, as well as their normal values, are listed here for your reference. But again, I want to stress that this is less standardized. And lastly, depending on which LFT values are predominantly elevated, this could indicate different pathologies. For example, if AST is elevated more than ALT by a ratio of 2 to 1, this suggests alcoholic liver damage. If ALT is elevated more than AST, this suggests viral hepatitis or fatty liver. And if ALP is elevated along with bilirubin, this suggests biliary obstruction. Thank you.